Good morning. It's morning at the moment anyway. Okay, this is the start of week 3, so we just had week 2, which didn't go so well only due to not being able to attend through the snow problems we've had. Okay, so we've had about 3 days of course last week, and then the other 2 days we had to do basically homework to catch up on. So not ideal, but you know, you can't help the snow. So last week what we did was basically have a look at the airway adjuncts, which are the ways to have a look at the opening of the mouth, checking nothing's inside, not using the finger scoop because that's no longer used anymore, just literally look inside the mouth and take out with forceps, or you know, if you can use your fingers on the side of the mouth, or suction. Excuse me. And the other thing is using airway adjuncts. I think that's pronounced adjuncts. So comment if I got it wrong, sorry. So basically using a nasal pharyngeal, which is an MP, which goes into your, obviously, your nose catheter, I suppose, or nose tube. And the other one was an OP, or an oral pharyngeal, which is the one that goes in the tube that goes into the back of your throat, and both of these keep your airways open. And we were taught, and we will be re-taught again today, how to size them up per patient, and how to administrate to them. So that was really good. And then we also used a bag mask technique. So instead of obviously doing a mouth to mouth, which is only needed if you are first on scene, you haven't got any equipment, we use a bag valve mask technique on top of the adjunct. But yeah, we'll go more into that this week, I think, just to cover bits that we've lost time last week. Yeah, so that was really interesting, actually. Excuse me, so I've got a bit of a cold today, or foggy throat, so I apologise. So we were doing that on a Rassasiani, or half a Rassasiani, so we can see the lungs opening and closing, which is really interesting. And the paramedic who was teaching us, Joe, basically used a I can't remember the name of the word. It's like a larynx scope or something. Don't know, I've probably said that all wrong. But basically opening up the airway to have a look inside, moving the tongue to the left, and then putting the adjunct in. Okay, so I got that wrong. And we're not supposed to be doing that as an ECA. Just the paramedics do that bit, but we can put the adjuncts in, as in the OPs or the NPs, and of course do the bag valve mask technique. So that was just the 3 days we did last week. So over the weekend and the last 2 days of last week, I was looking at the book, just checking the names of things like what a bougie is, and an ET tube and all that sort of thing. But the book that they give you is really good because it covers everything you need. It also goes in with the online learning as well. So if you haven't got the book with you, you go on the online learning. You can recap on there as well. So it's always drip fed to you in one form or another. So whatever method helps you. I mean, I use all of them because stupid head, I can't remember everything. So that's the way I do it. Okay, so this week I believe we are just covering the rest of the airways, which we didn't cover last week, and I think we've got our basic knowledge test sometime this week, which is just basically what do we know about the heart and breathing and diabetes and all that sort of thing. So we'll just have to, you know, keep your just to keep our information up in our head, really. I don't think it's a pass or fail. I think it's just a knowledge test. The pass or fail thing is going to be the physical, I believe, primary survey at the end of the 5 weeks, but don't quote me there. We'll see what happens when we get there. Right, as you see, all the ambulances are here now, so they're all lined up. Whether they'll be looking at where things are on the ambulances today, equipment wise, we don't know, but we'll find out. Okay guys, it's time for me to go in, so I will talk to you, and give me a shout, let me know how you're getting on. Best of luck. Bye for now.